Welcome my colleagues and my dear students. Today we are speaking about an important application in our subject respiratory system, which is hypoxia. As we know, the significance of respiratory process is to extract oxygen from atmosphere and to provide it for the process of biological oxidation to obtain ATP that is needed for all aspects of human life. When there is a disturbance in the process of delivery of oxygen to the tissues, we have hypoxia. Whether the defect in the atmosphere itself, in the process of pulmonary ventilation, gas exchange, oxygen transport by the blood, or even in the enzymes at the level of the tissues. We have important facts to know before discussing the details of hypoxia. First of this, how oxygen is transported in blood. Normally, if we take 100 milliliters of blood, we will find that they contain about 90.5 milliliter oxygen, and they are present in two forms, physical form and a chemical form. The physical form represents only 2%, which equals 0.3 milliliter. However, the chemical combination represents about 98%. It is the amount of oxygen that is carried on hemoglobin. It equals about 19.2 milliliters. So most of oxygen in blood is in the form of a chemical combination with hemoglobin, and the volume that is physically dissolved is so little, about 2% only. However, the oxygen tension, the PO2 in the arterial blood, is dependent on the physically dissolved oxygen, not the chemically combined oxygen to hemoglobin. We have important definitions. What is meant by oxygen content in blood? This is important definition in the science of gases. It is the volume of oxygen that is chemically combined to hemoglobin in 100 milliliters of blood. It depends on the hemoglobin content and on the oxygen tension. So when there is normal hemoglobin content and when there is a much increase in the oxygen tension, you can expect that the content is high. When there is a reduction in hemoglobin or in the oxygen tension, you can expect that the oxygen content is little. Oxygen capacity. Oxygen capacity is the volume of oxygen that is carried on 1 milliliter of blood in chemical combination with hemoglobin when hemoglobin is fully saturated. Why the value is 20 milliliter of oxygen? Under normal condition, we have 15 grams of hemoglobin. The full capacity of each gram of hemoglobin is to carry 1.33 milliliter oxygen. So to calculate the amount that is carried over these 15 grams of hemoglobin, it will be 15 multiplied by 1.33, and the result will be nearly 20 milliliter of oxygen. This is called the oxygen capacity of the blood. We have also what is called percent saturation. Percent saturation equals the content over the capacity multiplied by 100. It is the percent saturation. To simplify the concepts of the content, the capacity and saturation, take this simple example. If we have a taxi and it has seats for 4 persons, so its capacity is 4. However, the content may be 1, maybe 2, maybe 3, and maybe 4. When the content is maximum, it will be equal to the capacity. If we have 2 persons inside the taxi, so the percent saturation is 50%, because we divided 2 over 4, the content over the capacity, it equal 50%. This is a simple example. We have also important definition, which is the physiological shunt. Shunt means mixing of venous blood over arterial blood. Normally, the blood that is delivered from the lung to the heart, its saturation is 100%. However, if we take a sample of blood from the aorta, it is about 97.5%. It is decreased by 2.5%. Why? The explanation is that there is a venous blood that is added to this arterial blood. It is derived from the wall of the left ventricle and the wall of the left atrium and from the bronchial vein. A venous blood with a percent saturation 70% added to a blood with a percent saturation of 100%. So it is decreased to 97.5%. This is called physiological shunt because this is a physiological condition. So that the highest percent saturation normally in the arterial blood is 97.5%, not 100%. Let us speak in details about hypoxia. Hypoxia means oxygen deficiency at the level of the tissue due to a defect in the respiratory process. Under normal condition, we extract oxygen from atmosphere. It enters the lung through the process of ventilation. Then it is transmitted to blood via gas exchange. It is carried normally by hemoglobin in order to get its final destination inside the tissues, where it is used in the process of oxidations utilizing different types of enzymes for production of ATP. This is a normal pathway of the respiratory process. However, if the process is disturbed, whether the disturbance in the atmosphere or a defect in external respiration or a defect in the respiratory function of blood or even a defect in the internal respiration like any condition that inhibits the tissue enzymes, any of these causes will cause hypoxia. However, the type of hypoxia differs according to the site and the nature of the cause, so we have four main types. If the defect is present before blood, usually we call it hypoxic hypoxia. If the defect in blood, we may have anemic hypoxia or stagnant hypoxia. If the defect is in the tissue enzymes inside the cells, we call it histotoxic hypoxia. Hypoxic hypoxia is a type of hypoxia that is characterized by low oxygen tension in the arterial blood. This is the most important criteria for the hypoxic hypoxia. To determine or to nominate hypoxic hypoxia, there must be low oxygen tension in the arterial blood, whatever the site or the nature of the cause. We have many causes for hypoxic hypoxia. First, breathing air with low oxygen, like high altitude and mines, where oxygen in the atmosphere is so little. Number two, if there is a ventilatory defect, if there is obstructive lung disease, COPD, chronic obstructive lung disease, if we have weakness in respiratory muscles like poliomyelitis or severe myositis, we may have central causes like respiratory center depression that occurs with morphine poisoning. Defective gas exchange like conditions of pulmonary fibrosis, which are caused by the long-standing smoking. Also, shunting of venous blood over arterial blood. This is caused by congenital cyanotic heart disease. The characters of hypoxia are so important because it summarizes the condition of the hypoxia and gives the idea about the clinical state of the patient and the expected benefit of treatment. So we speak in the character about 5 items. First, oxygen tension. Number 2, the oxygen content. Number 3, the oxygen saturation. Number 4, cyanosis present or not. Number 5, and finally, oxygen therapy. Is it of value or not? Because it is logic to treat hypoxic patients with oxygen. However, in some conditions, treatment with oxygen is useless. First, oxygen tension. Oxygen tension is decreased in the arterial blood and in venous blood. And this is the main criteria of hypoxic hypoxia, as I said before. Oxygen content. Oxygen didn't reach its normal physical levels, so you can expect easily that the oxygen content that is present on hemoglobin is also reduced. When the content is reduced, by consequence, saturation is reduced because saturation equals content multiplied by the capacity. So if the content is decreased, saturation is decreased, cyanosis is present in hypoxic hypoxia. So most causes of hypoxic hypoxia are associated with a central type of cyanosis. The condition is improved with oxygen, so oxygen treatment in hypoxic hypoxia is so valuable. Second, anemic hypoxia. It is a type of hypoxia that is characterized by deficiency of hemoglobin that is capable of carrying oxygen. The causes are variable. They may be anemia, actual deficiency of hemoglobin, or actual decrease in the amount of hemoglobin in blood. Number two, pseudo poisoning, where you have hemoglobin but it is not functional. Also, sulfhemoglobin in the conditions of poisoning with hydrogen sulfide, or in methemoglobinemia, in which hemoglobin is oxidized. In the last three conditions, you have hemoglobin but it is not functional, so it is functionally deficient, so it is incapable of oxygen carriage, so we have anemic hypo. Regarding carbon monoxide poisoning, carbon monoxide poisoning is a common cause for the anemic hypoxia. As we know, carbon monoxide is a component of the natural gases in our houses. It is common type of poisoning. It is tasteless, colorless, odorless, non-irritant gas, so it is a silent killer. These are dangerous criteria because of the presence of a specific taste, specific odor, irritation. This makes the person cautious of the presence of the toxicity. However, absence of this criteria makes it a silent killer. Toxicity of carbon monoxide is because of it combines with hemoglobin at the sites of oxygen carriage, but with affinity about 200 times better than oxygen. So if oxygen and CO are present, CO will occupy the sites of oxygen and prevent oxygen binding to hemoglobin. Moreover, it prevents the remaining hemoglobin molecule from releasing their oxygen content. So it converts hemoglobin molecule into a useless oxygen carrier, causing a dangerous condition of CO poisoning, which may be fatal in some situations. Methemoglobinemia, a condition in which the ferrous oxygen on hemoglobin is converted into ferric. As we know, normally oxygen binds to the ferrous iron on the hemoglobin molecule, and the combination is oxygenation, not oxidation, so it remains as it is ferrous. However, if the body is exposed to certain oxidizing agents like nitrites, these substances will oxidize the iron and convert it from ferrous into ferric. This firm combination will prevent oxygen release to the tissues, so it becomes a useless oxygen carrier. What about characters of anemic hypoxia? We have the 5 characters. First, the oxygen tension. The oxygen tension is normal in arterial and decreased in venous blood. It is normal in arterial blood. The only condition in which oxygen tension is decreased in arterial blood is hypoxic hypoxia. Any other type, the oxygen tension in arterial blood is normal. However, it is decreased in venous blood because tissues will extract more oxygen, so it is logic to be decreased. The oxygen content is decreased because oxygen sites are occupied or hemoglobin is deficient. When the content is decreased, so that the oxygen saturation is decreased by consequence, as I said before. Cyanosis, in most conditions, no cyanosis, because in CO poisoning, the color of the skin is cherry red, and in the different types of anemia, no sufficient hemoglobin in order to produce cyanosis. Also, no cyanosis with sulfhemoglobin or methemoglobinemia. Oxygen therapy of limited value. It is helpful. However, we need many measures according to the type of anemic hypoxia, whether it is methemoglobinemia or CO poisoning or sulfhemoglobin and so on. The third type is stagnant hypoxia. This type of hypoxia occurs because of blood stagnation. No problem in gas exchange or pulmonary ventilation. No problem in hemoglobin. The problem is in the transport process. There is much slowing in the circulation, so oxygen delivery to the tissue is delayed. There may be a state of shock or a condition of heart failure. In this condition, we call it general stagnant hypoxia because of a general cause that involves all the body. However, in some situations, it may be local. The stagnation process is local, limited to certain area of the body like one limb. This can occur when there is obstruction by thrombosis or there is marked vascular spasm in the famous disease, Raynaud's disease. In all these conditions, the process of stagnation is limited to certain area inside the body. So we call it local stagnant hypoxia. This is Raynaud's phenomena, which is common in some persons, especially in the winter. When the person is exposed to cold weather, there is a stagnation in the circulation in the periphery, so there is a state of stagnant hypoxia, and it is associated, as we see, with peripheral cyanosis. It is also clear in this condition. What about the characters of stagnant hypoxia? First, the oxygen tension. It is normal in arterial blood. It is normal in all types of hypoxia except hypoxic hypoxia, and it is decreased in the venous blood. Regarding oxygen content, it is normal. No problem in oxygen carriage. The process of transport is a problem, not the process of loading itself. So the oxygen content is normal, and by consequence, saturation is normal. Regarding cyanosis, it is present, whether central or peripheral, according to the type of stagnation. General stagnant hypoxia is associated with central cyanosis. Peripheral stagnant hypoxia is associated with peripheral cyanosis. Oxygen therapy of limited value. The problem here is not in the oxygen carriage. The problem is in the transport. When you give a patient oxygen therapy, it may improve partially the condition, but it will not treat it. You must treat the cause, whether it is central or peripheral cyanosis. Histotoxic hypoxia, a condition in which everything is normal. Normal oxygen in the atmosphere, normal gas exchange, normal pulmonary ventilation, normal oxygen transfer. The only abnormal condition is inside the cell, where the enzymes that is needed for biological oxidation are intoxicated, either by cyanide poisoning or by alcohol, which are the famous two causes of histotoxic hypoxia. So there is paralysis of the enzymes inside the cells. The most common cause is cyanide poisoning, and cyanide is a famous toxin that is widely used in many industries, and it is also used as a toxin. It has a soluble form, it has a solid form, it has a vapor form, and many other forms. Cyanide poisoning is so dangerous because it blocks about 40 enzyme systems inside our body. The most important of them is cytochrome oxidase system, thus stopping production of ATP and stopping the process of biological oxidation. So the production of ATP is stopped. Most of biological activities will stop by consequence, and there is accumulation of lactic acid because of stoppage of aerobic oxidation and the dependence on the anaerobic glycolysis because of toxicity of the enzymes of aerobic glycolysis. It is so dangerous conditions, and when inhaled by a large amount, it is rapidly fatal gas. Regarding the characters of the histotoxic hypoxia, you can expect most of the items. Oxygen level is normal in the arterial blood. It is decreased only in hypoxic hypoxia. However, in the venous blood, it is increased more than its normal value. It is the only condition in which venous blood oxygen is higher than its normal values because it is not consumed. No oxygen consumption. Enzymes are inhibited. Oxygen content normal in arterial blood but increased in the venous blood, not consumed. By consequence, oxygen saturation is normal in arterial blood and increased in venous blood. Cyanosis not present because persons with histotoxic hypoxia are further than normal persons from cyanosis because they don't consume oxygen at all. Oxygen therapy is of no value. The process is not oxygen at all. He has so much oxygen. The problem is the enzymes that are intoxicated. Finally, I would like to summarize some important points. First, hypoxic hypoxia. It is the only type of hypoxia in which there is decrease in oxygen tension in the arterial blood. Oxygen in venous blood is decreased in all types of hypoxia except histotoxic hypoxia. warfarin therapy is valuable in hypoxic hypoxia, of little value in anemic and stagnant hypoxia, and of no value in the last type, which is histotoxic hypoxia. Regarding cyanosis, it is present in the first and the third type, the hypoxic hypoxia and the stagnant, and it is not present in the second and fourth type, in the anemic and in the histotoxic hypoxia. Finally, thank you and goodbye.